Welcome to BizTV's Beyond the Brand. I'm Kelli Phillips. Today we're joined by chiropractor Dr. Kenyon Godwin. Dr. Godwin runs Active Family Wellness Center in the DFW area and is passionate about helping his patients of all ages live pain-free lives. Stick around for more Beyond the Brand. Today we're sitting down with a doctor who's all about helping families get active and stay well. He's the man behind Active Family Wellness Center, and he's joining us right here in the studio. Please welcome Dr. Kenyon Godwin. And Kenyon, I've got to ask first, your background. Where'd you grow up? What was life like before you got into this?
That's a good question. I am from Virginia originally, and most people think of Virginia, they think of Virginia Beach or maybe Richmond. They think of what I call the main triangular-shaped state.
Right.
But I'm actually from the peninsula, which is almost an island out in the Atlantic Ocean. And so that peninsula is called it was the original DMV. It's Delaware, Maryland, and Virginia, all on this one little strip of land that sticks out in the ocean. So I'm separated by the Chesapeake Bay from the mainland of Virginia, and then on the other side is the Atlantic Ocean. So that's where I'm from. Growing up there was very different than probably most places I've been to since, in the sense that it is like very rural, very small. So my town, 800 people.
Nice.
That whole 60-mile peninsula, that's Virginia, maybe 7 stoplights, one hospital at the very tip. And, it was just a very different life. So growing up, single-parent household, poverty, the main employer there, like here in Arlington, we have GM assembly plant, and it's a big deal. Well, where I'm from, they have Tyson's and Purdue Chicken. And that is the assembly plant that 70% of the people that live work there. So just for context and contrast of what that was like.
And how did you get into what you're into today? What was your path?
So it started before I actually went to school. So around 12 years old, my mother had a heart attack. And so as I mentioned earlier, single parent household. She was the parent I lived with. My mom worked at Tyson's Chicken, no insurance. She never made over like $800 a month. So when she had that heart attack, we all got split up temporarily while she was in the hospital in an ICU. But once they got her stable, they just sent her home because she didn't have insurance and she didn't have the money to pay for the procedures or the medication that they were recommended. And so I just remember as a kid thinking in my head, if no one's going to help her, I'll figure out how to do that. And that's what first inspired me to be a doctor. It wasn't because I came from a family of doctors or that environment. It was just out of that temporary pain and that trauma that created a purpose. And that started me on my journey. So I went to the Air Force at 17 years old, directly out of high school, had a medical job, and that reignited that passion for helping and serving and wanting to be a provider. And so I just followed that path and learned about chiropractic, which to me was amazing. It fit my lifestyle. It was natural. It was holistic. It was nutrition. It was exercise. It was working with the body and the nervous system versus medications and surgeries. And I didn't want to deliver babies. So it worked out well. And that's how I ended up being a chiropractor and got out of the military and moved from Alaska to Texas to go to school for chiropractic.
Talk about another culture shock, right?
Right. Very much so.
You started Active Family Wellness Center, and you've got a wide range of services: chiropractic, functional medicine, rehabilitation. Why did you want to start that?
So originally, we started with just chiropractic care, which in and of itself is robust and complex and very effective. But people today are different than people have been generations before. Our lifestyles, our habits, the source and quality of our food and our environment. There's more toxins and more stress involved. And now there's car accidents and things and injuries that are also elevated. So adding rehabilitation first was a way of complementing the chiropractic care. So someone's had trauma, and sometimes that trauma is mental, but people's body seize up in stress. So adding a way to correct. I always wanted to get to the correcting, the underlying cause to correct it. So the exercises, we call them corrective exercises, not just rehab. And then with that, I had we call them practice members instead of patient, but I had a practice member named Mr. Floyd, and he was driving 2.5 hours to come see me. And, he found me back then. I was open on a Saturday. Sorry. So he found me on a Saturday morning. I was the only one open. His back went out, and he was very overweight. And so I helped him with his back, and I was just trying to chime in with, hey, man, you want to work on the metabolic issues, the weight, you're getting your blood cholesterol and those levels together. But I didn't have a system or a structured way to do that. I was just trying to give him advice when I saw him. And then I got a call in February, about 9 years ago, from his girlfriend. Even though he was like 64, he was so close to retiring, and he was still working hard at this job. And he had passed away in his sleep from a heart attack. And I just had a conviction that I want to find a better way, a way that I can systematically serve and help people, not just giving them some health advice here and there, but how can I find a way to integrate what I know and help lead people not beyond pain, but to a purposeful life where they're whole and healing and thriving. So that's how I got into the functional medicine and metabolic things.
So how does your corporate wellness programs contribute to improving employee health, productivity, even morale?
Man, that's a great question. I love corporate wellness because when you do it right, it has a tremendous return and impact. So first and foremost, we're talking about stress. At the end of the day, I want you to think about with health and disease, a lot of the underlying cause of that is some type of stress. It can be chemical. It could be what we're putting in our bodies or what we're eating or putting on our skin. But a lot of it is stress related. Well, the workplace is most people's biggest source of stress. And it doesn't mean it's bad. It could just be a deadline, a time of year, a time of month. We got things to do. So we like to come in and do an assessment. Let's figure out where everyone is with a baseline, with their health, with their stress. And a lot of those things are anonymous. So we're not telling on, this person feels this way. But then helping them better manage their stress and then helping them correct a lot of the metabolic fallout and consequences from the stress and from maybe their lifestyle habits and choices prior to us intervening. By doing that, we now increase their energy, their engagement. We decrease their sick days and days that are missing out. Everyone's now fired up and working on the same cylinder. And when an employee sees that their employer really cares about them and values them, and wellness isn't just something they're checking off, but it's actually they care about their people, performance goes up. And now we're holding each other accountable. So like, hey, how's your water going today? That's all the water you've had? So just little challenges and little things. And it pays it forward and pays it back over and over and over.
So do you have businesses that come to you and all of their employees come to you, or do you go to them?
So actually, with corporate wellness, chiropractic care is not included in our corporate wellness. That's a myth, so I'm glad you asked that question. So most of my corporate wellness programs are either virtual or I go on site and do teaching, classes, challenges, things of that nature. It's not so much service-based as it is education and tools that we can measure and assessments that we can continue to reassess and show the data of this is the improvement of the employees in the workforce, and then they can match that with their financial numbers and look at those things.
Explain the importance of the 3 Ps. What are they?
Yeah, so 3 Ps are what we typically talk about when we're dealing with a prenatal client. And technically it's 4 Ps, but I'll go over them briefly. So the first P is power. I don't know, have you ever had a baby?
Yes.
All right, I haven't. So
thanks for clarifying.
Just want to make sure in today's world. So the first P is power. So if you have to push, you have to generate some power from your core, from your hips.
Right.
Okay, so that power, the source of that power comes back to the lower back and the pelvis. Mm-hmm. So we make sure that's aligned so that you have the power to push. Okay. Second P is the passage. That's going to be the pelvis, right? It's shaped a certain way so that the passenger can fit inside a certain way. The third P is the passenger. The passenger needs to be face down and facing back towards your butt. That's the proper alignment. if that structure gets off, right, someone's misalignment in their spine, which we call a subluxation, if they have a misalignment in their spine, lower back or pelvis, it can affect all three of those components. And now you're looking at the likelihood of C-section or long birth, long labor process, painful labor, things of that nature. So we want to reduce those as much as possible.
Is the fourth P pain?
No, the fourth P is postpartum. So afterwards, helping hormones in the body come back into proper alignment. I mean, that's a big event, having a baby, from what I've seen.
Absolutely.
And with a mom, they have a lot of lower back pain during pregnancy. Mm-hmm. After pregnancy, though, that pain tends to shift and move up to the upper back because now they're holding the baby, they're feeding. And the last thing I want is for a mother to have resentment about feeding or bonding with the baby because they're in pain. Now, they may not think of it as resentment, but they're like, just being tired or this hurts. So we try to just make sure we contribute towards the whole family. And with the breech babies, we are currently 34 for 37, which means 37 women have come to me with their babies breech, and 34 of them have gotten back into position for a natural, normal birth.
That's incredible. We've got lots of other questions, but we have to take a quick break, so stick around, and we'll be right back to talk with Dr. Kenyon Godwin. And we're back with Dr. Kenyon Godwin talking about Active Family Wellness Center and chiropractic practice. Some people don't really understand, and there are a lot of misconceptions. Can you clear some of the misconceptions up?
Yes. So chiropractic, people think that when they come to a chiropractor that we're cracking or popping something. I hate when people say that. That's not what happens. The noise that you hear is just air being released. It's just air that's built up in between the joint capsules. As the joint capsule gets realigned, the air gets released. So we're not cracking or popping anything. And some people think, well, oh man, if I go to a chiropractor, I heard once you start going, you got to go for the rest of your life.
Is that not true?
It's not. You go as long as you want the benefit of going. Okay.
But how often do people get misaligned?
Very often, but that frequency and intensity changes over time. So I would ask you this question is, how often or how long are you going to have to go to the dentist?
Probably as long as I've got my own teeth.
Right. And as long as you want to make sure they're healthy, right?
Right.
As is chiropractic. But the frequency and the intervals look different. If you waited until today at this age to go to the dentist, would it be pretty intense?
Oh, yeah.
If this is your first time?
Absolutely.
Right. But then once they got that together, they wouldn't have to see you as often.
So it's the same with chiropractic.
It's the same thing. The problem is most people don't start seeing us as babies and kids. So
is that a regular thing?
It is in my office,
kids and babies?
absolutely. It's so much easier to get to it in the beginning and realign things. So I don't just see prenatal. I don't just see pregnant women. I see their babies, their newborn babies and their kids. And those kids do well. They develop well. They have fewer issues. That's the way it's intended. So I look at chiropractic just like, your smartphone. You are like your smartphone. Your brain is the battery, okay?
Okay.
Your Wi-Fi, that's your spine. So in order for your apps to work, that Wi-Fi has to be fully connected and running. If your signal gets low or gets weak, things don't work properly. So in the real world, we interpret that as elbow, shoulder pain, headaches, digestive issues. It can be a lot of different things. So it's not that I am necessarily cracking a bone or fixing an area. I'm just boosting your signal in that area so their body can work the way it's supposed to work.
Interesting. What are some rewarding stories that you have that you can share with us about your business?
I have so many, so we don't have time for all of them.
Just pick your top.
Okay, I'll pick two, and they're in two different areas. One was a young lady named Zoe. This was my oldest daughter's school friend, all the way from elementary school. Anyway, from the time we first met her, she was always in a wheelchair. She had been in a car accident with her family. And so she was, paralyzed from then on. And so she had no feeling in her legs. She came to me a few years ago, and she was having back pain. She had never had back pain before. So, we worked on her, got her out of the wheelchair onto the table, figured out how to work with her, and she's pretty strong and tough. And after working with her for a few weeks, she was able to start feeling the bottom of her feet for the first time since she was a little girl. So I gave her some things. I worked on her legs, and I was just curious. And sure enough, she could feel the floor was cold. she could feel that it was wet, and she had never felt that, or hasn't felt that since she was a little girl.
What did that do for you?
Just made me thank God. It made me more aware of what we do and the impact of what we do. And secondly, from a functional medicine standpoint, I had a gentleman that was diabetic, really diabetic, lost his eyesight, had part of his foot amputated, and his blood sugar was extremely high when I did his blood work. And after about 2 months of working with him, we were able to get his blood sugar levels down tremendously, his hemoglobin A1C down tremendously. And so just seeing that someone's body can change without medication, it's amazing, because most people wouldn't believe that when you look at how high those numbers were and what he was dealing with. And he was my age. So when you see that does something to you, but it makes you on fire to want to reach more people.
How important is it to you? So many people, they turn to drugs as an instant fix. But granted, conventional medicine is needed, but there are times where it only masks a symptom. But you're coming in and turning people's lives around with chiropractic, with some of your other medicine forms that are more a holistic approach, correct?
Correct. So at the end of the day, it's about getting to the underlying cause. If you're having a headache, it's not because your body is low on Excedrin. Right? If your blood sugar is high, it's possibly your diet, your exercise habits,
what
your
you're
sleep
putting
habits.
In.
And then there's a stress response we talked about earlier with corporate wellness. Mm-hmm. Your body has an almost predictable pattern when it's been under stress for a long time, how chemicals and hormones start changing. So I just look at all of that from the big picture standpoint and just say, what can we change? What can we help you correct and fix so that you can be healthier? Because healthy people don't take medication. Because if you're healthy and you take medication, it makes you sick. But most people would rather just take something and not do the work and have the discipline to get better. They just want the quick fix.
They want the magic pill.
Right.
I put on this extra weight and I just want to take a magic pill to take it off as opposed to work at it.
Right. So a doctor that was a mentor of mine, I love the quote he said, that you can't chemically change a problem that you behaved your way into.
Ooh, that's deep. How do you integrate online services into your practice to reach and support your patients that are remote? Great.
So we use platforms such as Zoom, things of that nature, and we can do labs. I can do all functional medicine fully virtual. I have people I've never met, but I've helped them. The young man that I mentioned to you that was blind and had the blood sugar issues, I've never met him in person. It's all been online and virtual. So we're able to still do those services. Chiropractic services we can't do virtually.
Exactly.
Not yet, I guess, but
it's coming, maybe with AI.
No, it shouldn't. It's so specific, you can't duplicate it. I got job security there. But we do use virtual for the holistic medicine and helping people with their gut health and things of that nature.
Talk to us about your speaking, because you go and do speeches. What do you talk about, and what's some of the impact that you've seen that you've made?
I love to help people with clarity, with their mindset. That's why we call it alignment. So I help people from the chiropractic standpoint. We understand alignment. And then I realize that a lot of people, their lives are so stressed because they're out of alignment. So there's 3 V's that I focus on with my framework. It's called the Align framework, and that is vision, values, and vitality. So be aligned with your vision, not just doing something because someone told you to or it's the popular trend, but make sure that you're connected to what God's purpose is for your life and that what works for you and that you operate out of that. Those values, making sure your values are your filter. You know, if you don't have values, you could do anything and make any kind of decisions. But my values dictate my principles and how I respond to situations, who can be in my life, what relationships I can be in. And then vitality is the health, because you can have the best purpose, the best vision, the best values. But if you're not healthy enough to carry on the work and do the work, then your productivity will wane. And then you can be, discomfort, distressed, and just not feeling at your best because you're not achieving at the levels that you would hope to achieve. So I've been able to see people, I love seeing the light bulb go off when they understand that you don't have to be anyone else. You just need to be you. but be in alignment with who you are and what you want to do. And just your authenticity will come out, and you really thrive and shine when you can walk in that confidence of knowing you are completely in alignment with what you were created to do.
I've got to go back to the beginning.
Sure.
What does your mom think about what you're doing now?
My mom's told me several times that she's very proud of who I've become and what I'm doing. And so it's definitely rewarding to see and hear that. I'm just grateful for the things that I've seen. It's hard to say that when you've seen pain and trauma, but I understand now the bigger picture, and I'm grateful for everything that I've seen and experienced because it's helped me become who I am. And I just want to continue to honor God, honor her, honor my family by doing the very best with what I've been given and what I've been entrusted with.
How can folks find you? How can they find out more information about you coming to speak to them? So many questions.
So for speaking and consulting services, you can find me at literally kenyongodwin.com. For the practice, we have our website, Active Family Wellness Center. We're on social media as Dr. Kenyon, as Active Family Wellness Center, and the Alignment Authority is the tails I have for Instagram, Facebook. So pretty easy to reach, not hard to find at all.
And you're willing to help anybody. They just need to be open.
Absolutely.
All right.
Absolutely.
Dr. Kenyon Godwin, thanks so much for joining us.
Thank you for having me. I really appreciate it. This is cool.
Thanks for watching BizTV's Beyond the Brand. Be sure to subscribe to the BizTV YouTube channel, where you'll find full episodes of this show, fresh BizTV content, and a few surprises each week to help you stay inspired.